later. Let Reshma give you her experience with orthoptech. These are all my Finnish bhaktas who understood what I was trying and said, okay, we will buy. Now I have over 85 people using it. Reshma, you
I thank Dr. Santan Gopal to include me in his IC and he has given me this opportunity to present a few cases which I have of orthoptech treated, and all of them are very happy. Thank you, Dr. Santan Gopal, sir. Yes.
And you have been using it orthoptech
For 3 years.
3 years. There we go. They are all initial converts. So they are like the first 12 converts of Jesus Christ. These people are in initial converts.
So actually it was during the COVID times when there were no surgeries going on, and patients used to come, and there was no treatment for amblyopia or squint surgeries, and patients were not ready for surgeries then. So we had started using orthoptech treatment, and we found wonderful results, and I'll present a few cases. So amblyopia or a lazy eye is a condition in which one or both eyes have a weak vision, and the weak vision is because of the poor development of the vision centers in the brain. Amblyopia, as age-old method, we used to be treating with patching. We patch the good eye and the weak eye is forced to see things. But here we are doing forced to see the red lights and the green lights, and the patient has to be very, very vigilant in pointing the orthoptech machine, but not patching at all in the other hours. So types of amblyopia which we have treated in order of frequency: anisometropic amblyopia, bilateral ametropic, meridional, and strabismic. And as Dr. Arun Samprati sir said, even I have had very few cases which have improved in stimulus deprivation amblyopia, but the others have shown good results. Recently, computer exercises have been introduced where both the eyes as well as individual eye can do these exercises, which ultimately improves the vision by stimulating the vision centers in the brain. In orthoptech, multiple areas in the brain are stimulated, which helps in improvement of vision. The prerequisites as shown is we have a ambient light room, 1.1 to 1.5 meters is the room size, the laser pointers required, and an eye patch. And we have a red light in the center and white lights in the periphery, and the patient is wearing his own glasses and doing the exercise. We will discuss some of the cases in which we advised exercise and got good results in the improvement of vision. There's a case of anisometropic amblyopia. He was an 11-year-old boy referred by a general ophthalmologist for suspected decrease in vision. No other significant history. His past history was normal, and family history and social history. TNO stereopsis chart shows left eye suppression, and we could read only the first plate of 400 seconds of arc. His cycloplegic refraction was minus 0.75 at 180, and left eye minus 2.75, sphere with minus 3 at 180. And after doing 25 sessions of orthoptech exercise, his vision in his left eye, which was poor, is now 6.6, and he can read the TNO stereopsis chart positively, the first, second, and the third plate also. So basically, for binocular vision development and good stereopsis, the patient is very happy that he can see the first 3 plates of the TNO stereopsis chart. In meridional amblyopia, in this patient, a 7-year-old girl, she has a smiling face in this picture, but the initial picture when she first came to my clinic was very cranky, and she was a misbehaving child with very bad performance in school. But after giving 15 sessions of orthoptech exercise with her glasses as minus 3.5 at 180 and left eye minus 4.25 at 180, there was drastic improvement in her school activities, in her daily activities, and even her handwriting improved. Like, there was a report card saying her mother was very happy, where she showed that there is good performance showing that handwriting has excelled. So this was something which we had not found with patching. So this is something which we had to inform sir.
Since this is an interactive session, I can stop you anytime. Yes, sir, I want sir. As chairman of the thing. This is to convey to the audience that why we use that laser pointer with the dominant hand. If there is a right hand dominant, you have to hold it in right hand. If it's a left hand, you have to, no matter which eye is blocked, which eye is amblyopic, we are not concerned. But what we are concerned is which hand he uses for primary work like writing or pointing things. Use that hand to point out the laser light, the lights which come on with the laser pointer. The reason is hand area, as Arun has pointed out, is very close to the frontal eye field area. They are closely situated. See, God, how he thinks. He didn't put the leg area near the eye area. Otherwise, leg would have drawn you everywhere, it feels like. So, hand area and eye area are very close. So, whenever the hand area is stimulated, the eye area automatically gets stimulated. Eye field area. Stimulation of eye field area sends back impulses again to occipital area to concentrate. So that's how handwriting improves and the vision improves. This is a small additional point to her observation. Continue now.
The next patient was metropic amblyopia, 8-year-old boy, which complains of poor vision. Right eye vision was 6/9 and left eye was 3/60. Again on TNO stereopsis, the patient could only read the first plate, that is not even the butterfly properly. It was less than that. The cycloplegic refraction was +5 with +1 cylinder at 80 and left eye +5 with +0.5 at 90. The vision was right eye 6/6 and left eye 6/24. And here we have a small video where the patient himself also tells about what he felt, his father. पहले कैसे देखता था?
पहले ऐसे देखता था, ये थोड़ा नीचे देखता था तो ऊपर एक आँख क्रॉस करता था थोड़ी। अब जब से यहाँ पर चल रहा है, इसका ट्रीटमेंट बहुत अच्छा है।
So the patient himself said that the informant father himself was very happy, and he said the cross-eyed or the up gaze, which are unexplained in meridional amblyopias, or where not only the vision improves but the entire face or the fixation also was better. Another case of metropic amblyopia, no, this is the same thing. This was something very difficult, but we just tried because he was a 20-year-old boy, and the parents were really apprehensive that a small child after a road traffic accident and he's lost his eye, and what can we do? So we asked, sir, can we try? He said, yes, you can. So on examination, there was right eye, which was a disc pallor, partial loss of vision by 3/60. And after giving 25 orthoptic sessions, there only fixation has improved. That searching eye movement is not there in the left eye, but fixation is improved, and the form sense that he can see on the Snellens that there is something written or there is some block there or a S there, that was there. But because he's a small boy aspiring to do some good professional career, so we had to try on something, and he does feel that yes, his fixation has improved. And not only there is a blank look or searching movements in his left eye, but at least when he's looking at something, both the eyes are parallel and straight. So this was another
here
case.
You can see his vision was only 360
3/60
and see 636. That's a tremendous improvement. It's from 360 to 636. For the patient, it's a tremendous subjective improvement. You must understand, vision is not just looking at the letters. The subjective feeling, how the patient feels, if you ask, within 1 hour after treatment, he says is much better. Everything looks much brighter. That's because of the added effect of the other eye on the amblyopic eye.
But adult optic atrophy cases or optic neuropathy cases, traumatic optic neuropathy, other road traffic accident cases, adults, which we tried, they never improved. But this was the only patient, 20-year-old boy, which improved. But there were other 3 road traffic accident patients.
It's variable. I have seen optic atrophy also, the vision improves. Thing is, it's variable. You cannot guarantee 100% because from the cortex to retina, those fibers, nobody has ever traced it.
Yes.
We need a lot more research on that.
Another intermittent exotropia, he is a son of an ophthalmologist who was referred, so 30-year-old dentist, but he used to always have difficulty in doing the root canal. He would say, my boss can do the same root canal and she tells me go in the depth and do it, but he would never be able to do the same. So she used to be very unhappy. But then we did some few sessions, 25-30 sessions. He would travel 100 kilometers all the way, but do them on Saturday, Sundays, and there was drastic improvement. He said, now I have cleared my exams and also I can do root canal in a much better way. He had ocular migraine also. That also got cleared because he had to drive all the way, and at the end of the day he had, because of his exotropia, he had fatigue, strain. Even that was improved because of the sir will explain, because of the conversions.
You finish that, in the end I will explain everything to them.
30-year-old dentist with 35 prism XT for distance and 18 prisms for near, with a refractive error of -0.75 at 15 and -3.5 at 160. There was no depth perception for this young male, and he complained of strain during doing the dental procedures. He also had eye fatigue after driving. We did 20 orthoptic sessions. His stereopsis improved, symptoms of eye strain also diminished, and he has a residual of 12 prism XT for distance and 6 prisms for near, but he's doing well and with glasses alone.
Okay, you present everything, then we will explain in the end.
Strabismic amblyopia, this was a residual XT of 10 prisms. After surgery, we did 20 sessions for him, and he is much better. He's a tailor boy occupation. So having exotropia, for long-standing exotropia for a long time, tailor boy occupation where he has to use both the eyes for fine minute work, we gave him, after his squint surgery, we gave him 20 sessions of orthoptech, and there is drastic improvement in his near work. Another 16-year-old girl with 20 prism XT. She was a school-going girl, 6'12", 6'9", with -0.75 cylinder in right eye and -0.5 cylinder in her left eye. After 15 sessions, her vision improved in right eye to 6'9", and left eye was 6'6" then. And she's orthophoric. This child here, this was the first case which we had the best correction after orthoptech exercise. So he was a 6-year-old male child brought by mother. The cycloplegic refraction was -2.75 in right eye and -3 in left. After orthoptech exercises, the vision improved to 618, 618. And initially the patient was not able to pick up toys or coins fallen on the ground. But later, after orthoptech sessions, he would not stumble while walking, and he could also pick up the small objects fallen on the ground, and mother was very happy. The child had an up gaze, up rolling of the eyeballs, and a faced, head tilt also. But after orthoptech sessions, we could see the central steady gaze, and the head posture is also straight. And on fundus examination, there was macular dystrophy, foveal hyperpigmentation. On OCT, there was changes in the ISOS layer, but still this has improved, which sir will explain. So the magnocellular stimulator has got good results. Basically, it reduces the time to recovery. We require less sessions, and it is a active dynamic movement of the hand-eye. Coordination is there, or there is something dynamically the patient is doing continuously, so it is not boring as to just patch the eye and think that the vision will improve. So 6 hours of patching, the patients and parents are very unhappy with it. Rather, they are very happy to come here and do a 30-minute or a 40-minute exercise, which they feel it is like a homework or a better activity for a child. So success rate of orthoptech can be easily estimated to more than 95% at 3 to 6 months of completion. And improvement in stereopsis, binocular and monocular vision is there, and stereopsis has improved rapidly in most of the patients than vision. Thank you. Thank you, sir.
Thank you very much for very succinctly and clearly putting in across your thoughts. First thing you must notice is she has treated in macular dystrophy. Actually, she guided me. She said, should we treat? Will it improve? I said, I don't know. We can try. After she tried, I also tried, and it improved. Particularly heredomacular dystrophy, where their color vision is not that good and the vision is not that good. I did orthoptech session, and that fellow was from Oman. He bought the machine from me and took it home. He said, can you sell the machine? I said, yeah, I can sell the machine, give the money in cash, take the machine and go. No problem. So he took it. And then at the Oman airport, he called me. Sir, tell this fellow that it's only 5,000 rupees. I said, okay. That I called and told him it's only 5,000 rupees. Yeah, nothing much in that. So he was given tax-free allowance or whatever. He took it home. And he keeps calling me in Arabic. He tells me, Wala, doctor, kulu kamam, means very nice. So macular dystrophy, it improves. Both children, the vision improved to 6/6. It's unbelievable, unimaginable. It was referred from anyone from Narayan Netralaya here? No, he has been to Narayan Netralaya. They also have orthoptic. I have given them. They didn't use. And he was sent back here from Indranagar to Koramangala. Then I said, okay, you stay here for 5 days. In 5 days, their vision improved. Both one about 12 and one 16. In both, the vision improved. They were very pleased. And I said, you need to continue treatment. I said, I'll take home and continue, and took the machine home. Now, the reason why in macular dystrophy the vision improves, I have not been able to figure out clearly. But I believe the top-down impulses come down right up to retina. Not just, they don't stop at lateral geniculate body. We all have been taught a lot of things based on certain knowledge at that time. Now, once they start using orthoptic, then they will have thousands of papers from the West. Then you will all be breaking your head, why I didn't buy when it was only 1 lakh, and now why should I buy when it's 1 million rupees? You understand? So, the reason why it improves is the corticogeniculoretinal fibers. We have to identify them. They come to retina and probably stop the apoptosis of the receptors. The reason why the vision is reduced is because of the receptor damage, apoptosis of the receptor. And that may be stopped by corticogeniculate retinal fibers. That is another 10 years away. After that, I may be around, I may not be around, but Raj Gopal and others will be here. They will tell you more. Raj Gopal is going to talk about his experience in orthoptic. I request all these people to travel to all corners of India and teach people and make them aware about orthoptic. It's a wonderful instrument, not just me saying that. People have come out and said it is a good, very good instrument for treating. Now, in the end, I will tell you why I think it is good instrument.